It's a case of a gentleman who had prior history of smoking, presenting with mild chest pain. So he underwent imaging, and the imaging included CT scan, then CT PET scan, that showed what appeared to be early stage lung cancer that could be really managed in more than one way. There was no evidence of distant spread. The tumor was localized to the left lung. There were suspicious lymph nodes in the chest and the mediastinum. These lymph nodes were sampled, or many of them were sampled by endobronchial ultrasound, and they did not show cancer. So really this case tried to highlight many things. Number one, how much do we trust in sampling of lymph nodes by endobronchial ultrasound? And actually I do have a significant degree of confidence in believing the results. But sometimes we also have to consider the lymph nodes that that technology is not able to reach. And that's exactly what this case showed. This case showed a left upper lobe lung mass with lymph nodes. We call that aortopulmonary lymph node or perivascular lymph node. Level 3 and level 5 lymph nodes in the chest are not really reachable by EBUS. So should we just ignore them and proceed with surgery up front versus considering this suspicious finding to be likely true finding and proceed with what we call perioperative treatment or preoperative treatment with chemotherapy and immunotherapy followed by surgery? The challenging part of that case is what happens in real life, in the community. I saw this patient and I presented it this way 2 days before a scheduled surgery. And sometimes we shy away from rocking the boat. Well, the patient scheduled for surgery, let him just go for surgery. But that's not what happened. Actually, I engaged with the patient. I told him my concerns. And the patient said, well, no, you've got to do the right thing. And I've discussed it with the surgeon. And we agreed to cancel the surgery. Ideally, all cases should be presented in a multidisciplinary fashion, discussed with the physicians before we reach a final plan for patients. And that actually happens at our site. But nothing is 100%. So I kind of assembled an ad hoc tumor board by calling the surgeon, calling some other people around me, and we ultimately canceled the surgery that was scheduled, and we're proceeding with perioperative chemotherapy and immunotherapy.